Hi everyone, I want to talk about Cymbalta or Duloxetine. Actually, the generic name is Duloxetine, while the trade name or brand name that is very common in my own environment is Cymbalta. Okay, let's go. Duloxetine is an antidepressant, but we can use it to treat many conditions. We'll go over that in a bit. It is a serotonin and norepinephrine reuptake inhibitor. In other words, it's going to increase the level of serotonin as well as that of norepinephrine. So we can just say that it's a drug that is working in two ways. It could be available as Duloxetine Generic or as Cymbalta or as Duloxetine, Drizalma Sprinkle, SANDOZ Duloxetine, Ariclaim, and so on. Uses, like I've said a while ago, is an antidepressant. I'll go into details of that in a bit. Could be used as anxiolytic in generalized anxiety disorder. In stress incontinence disorder, duloxetine is very useful. In individuals with fibromyalgia, duloxetine will be helpful. Also, in those with diabetic mellitus having neuropathic pain, duloxetine is a good choice. In musculoskeletal pain like osteoarthritis or rheumatoid arthritis, duloxetine is not out of place. In neuropathic pain, particularly post-chemotherapy induction, duloxetine will be very helpful. So we can see that duloxetine is very useful not only as an antidepressant, but in different ways. Forms. Duloxetine could be in form of capsule, particularly delay-release particles, and the generic form could be 20 milligram, 30 milligram, 40 milligram, or 60 milligram. Cymbalta could appear in form of 20 milligram capsule, 30 milligram, 60 milligram. Drizalma Sprinkle could be in the form of 20 milligram, 30, 40, or 60 milligram. Peripheral neuropathy due to chemotherapy, you can start by giving 30 milligram per hour once daily for 1 week. Then you can increase to 60 milligram per hour once daily. In generalized anxiety disorder, you can start with 60 milligram per hour once daily or 30 milligram per hour once daily for 1 week. Then you increase to 60 milligram per hour once daily, and the maximum dosage when it is about generalized anxiety disorder is 120 milligram per hour once daily. Still talking about forms and uses, in musculoskeletal pain like osteoarthritis or rheumatoid arthritis, the first thing is to try non-pharmacological measures. Try your non-steroidal anti-inflammatory drugs. Then, if you're not winning, you can start Cymbalta or the generic form duloxetine, 30 milligram per hour once daily for the first 2 weeks. Can then increase to 60 milligram per hour as the maximum dose. In fibromyalgia, can give 30 milligram per hour once daily for 1 week, then increase to 60 milligram per hour once daily. It is not necessary to increase dosage beyond this level. In major depressive disorder, you can start with 40 to 60 milligram per hour once daily, or you may choose to start with 20 to 30 milligrams per hour twice daily for 2 weeks. Actually, you are not going to feel the effects of most of the antidepressant until after 2 weeks of starting the medication. So you give that the start dose for 2 weeks. You can increase dose to 60 milligrams per hour once daily and keep that, but you can also increase up to 120 milligrams per hour once daily. In diabetes mellitus with neuropathic pain, you can start with 40 to 60 milligrams per hour once daily. The maximum dose expected here is 60 milligrams per hour once daily. In stress incontinence, that is urinary incontinence, you can give 40 milligrams per hour twice daily or 20 milligrams per hour twice daily for 2 weeks. Then increase to 40 milligrams per hour twice daily. In other words, you can just go straight to 40 milligrams per hour twice daily, or you start as 20 milligrams per hour twice daily for 2 weeks, then increase to 40 milligrams per hour twice daily. Warning. I don't like giving anybody any warning. I'm not a military officer commanding anyone, but when it comes to medical field and interactions with medications, we need to give ourselves warning. If you are administering Duloxetine to children or adolescents or even young adults, you have to keep an eye on the suicidal thoughts and behavior. That may be on the increase. So, you need to admonish the parents and all caregivers that they should please watch those signs and symptoms of suicidal thoughts, ideation, or behavior, and report any iota of changes immediately. Warning number 2. Don't stop Duloxetine cold turkey. In other words, don't stop Duloxetine suddenly, but as a physician, gradually taper the dose for weeks. For example, if the patient is on 60 milligrams per hour once daily, the first week, if you are making the determination to stop the medication, you can reduce to 50 milligrams per hour once daily and be decreasing by 10 milligrams every week. While switching to another antidepressant, remember, the new antidepressant will not be effective immediately. So, you have to gradually taper off Duloxetine while you start low the new antidepressant and continue to raise the dose of the new antidepressant. As you continue to decrease the dose of Duloxetine, you'll be increasing the dose of your new antidepressant. That is how you can comfortably switch from Duloxetine to another antidepressant without obvious crisis. Warning number 3. If the patient is formerly on monoamine oxidase inhibitor, you have to wait for 2 weeks before starting Duloxetine if you are choosing Duloxetine now. May I repeat that? If you are handling a patient and the patient is taking monoamine oxidase inhibitor before presenting to you, or is your patient but want to switch over to Duloxetine, then you have to wait for 14 days, 2 weeks, before you can start the Duloxetine at all. If there is renal failure, please don't use Duloxetine if creatinine clearance is less than 30 ml per minute, or if you are dealing with end-stage renal disease, no Duloxetine at all. If you have The situation at hand, that is hepatic failure, please no duloxetine at all. And the medication must be swallowed whole, don't crush, don't chew. However, you can sprinkle the capsule content on applesauce or in an apple juice, but don't crush the pellets. Warning number 4. Someone is telling me why warning. It's better that we take to all this so that the patient and the caregiver will both be happy in the end. Be careful in elderly. Anyone greater than 65 years of age, be careful. If you have any reason to use duloxetine, be extremely careful. But if you can run away from it in elderly, that would be great. Why? It can cause syndrome of inappropriate antidiuretic hormone, and the individual will have hyponatremia. Now, hyponatremia is a serious problem. And if at all you have to take the risk to give Cymbalta or duloxetine in elderly, that is, an individual greater than 65 years of age, please monitor the sodium very closely. The side effects. Yeah, someone has been waiting for this. Now you get it. Anyone on duloxetine could have a headache, become drowsy, so tell them not to drive, particularly if the medication is close to the time that they have to drive. Fatigue, nausea, abdominal pain, weakness, and weight loss. Still on side effects, they could become dizzy, the BP could shoot up, and there's possibility of diaphoresis, increased swelling. Libido could drop, so you need to cancel the couple. Same thing as erectile dysfunction in the husband. Constipation could occur, and there's possibility of increased tremor or blood vision. To those that are using it for antidepressant purpose, like major depressive disorder, could tilt them to mania or hypomania. There's possibility of dry mouth and increased suicide, like I have just talked about in the last few minutes, particularly in the younger age group. There is possibility of increased serotonin, leading to serotonin syndrome. Remember, I said it's a serotonin and norepinephrine reuptake inhibitor with the capability of shooting up the level of serotonin. And that may get to the rooftop where the individual will be having serotonin syndrome. Hepatotoxicity, that is the reason why I gave the warning that in hepatic failure, no duloxetine. There's possibility of increased teratogenicity, reason why we are not comfortable administering it in pregnant women. And that is not all. Syndrome of inappropriate antidiuretic hormone, particularly in the elderly, on account of which you have to monitor the sodium level very closely. Also, anaphylactic reactions or hypersensitivity is not ruled out. Anyone with duloxetine could come down with Stevens-Johnson syndrome or toxic epidermal necrolysis, particularly if they're taking the medication for the first time and they've never known whether or not they will react to duloxetine. Lastly, the contraindications here. Never, I repeat, never, please, never give duloxetine to anyone who had monoamine oxidase inhibitor in the last 14 days. The last 14 days. Don't give it, but after 14 days, you may. Don't start monoamine oxidase in 7 days after stopping duloxetine. I think I'm making it clear. Patient A is taking duloxetine, but you want to switch over to monoamine oxidase inhibitor. Don't start that monoamine oxidase inhibitor until after 7 days the individual had stopped duloxetine. Just like somebody who had been taking monoamine oxidase inhibitor must not start duloxetine until after 14 days. And in end-stage renal disease, don't give duloxetine, particularly if creatinine clearance is less than 30 mL per minute. Not in liver failure. So someone with hepatic encephalopathy, liver cirrhosis, and so on, please take off duloxetine off the table. Intravenous methylene blue and linezolid concomitantly while on Cymbalta is suicidal. Let me repeat that. Don't give intravenous methylene blue or linezolid while the patient is on duloxetine or Cymbalta, depending on the brand you are using. And with that, I've come to the end of this presentation. I hope the physician somewhere, or nurse practitioner somewhere, or even the patient that are taking this medication or your family members will benefit. Thanks for listening to my presentations. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you. I appreciate that.